Maternal adaptation during pregnancy. The changes that occur in the pregnant mother's body are caused by several factors. Many of these changes are caused by the growth of the fetus inside of the uterus. Some of the lesser-known signs of pregnancy: Chadwick's signs, which is a bluish-purple coloration of the vaginal mucosa and cervix; Goodall's signs, which is a softening of the cervix; and Hagar's signs, which is a softening of the lower uterine segment, or the isthmus. Let's look at some of the signs and symptoms of pregnancy. Presumptive signs are subjective. These include fatigue, breast tenderness, nausea and vomiting, an absence of menses or amenorrhea, and urinary frequency. Other presumptive signs include hyperpigmentation of the skin, called a pregnancy mask, fetal movements called the quickening, uterine enlargement, and breast enlargement. Probable or more objective signs include Braxton Hicks contractions and a positive pregnancy test. Another probable pregnancy sign is abdominal enlargement, which usually begins around week 14. Another sign of pregnancy that will be checked by your doctor is ballottement, which occurs between 16 and 28 weeks. The medical definition of ballottement is a sharp upward pushing against the uterine wall with the finger inserted into the vagina for diagnosing pregnancy by feeling the return impact or the bounce back of the displaced fetus. Goodall's signs, Chadwick's signs, and Hagar's signs are also considered probable or objective signs of pregnancy. There are different types of pregnancy tests. One type is a agglutination inhibition test. This test is used on urine specimens and include brand names such as Prognosticon and Gravindex. If HCG is present in the urine, agglutination does not occur, which causes a positive pregnancy test. Another type of pregnancy test, immunoradiometric assays. These types of tests are used on blood serum and include brand names such as Prognosis and Neocept. These tests measures the ability of the blood to inhibit the binding of radio-labeled HCG to receptors. This test is reliable 6 to 8 days after conception and has a 99% accuracy rate. The last type of pregnancy test are enzyme-linked immunosorbent assays, or ELISA tests. These tests can be used on blood serum or urine and can be found at the doctor's office or over the counter. These tests use an enzyme to bond with HCG in the urine if present. This test is reliable 4 days after implantation and has an accuracy rate of 99%. Positive signs of pregnancy include an ultrasound verification of the embryo or fetus at 4 to 6 weeks of age. Another positive sign is fetal movement felt by an experienced clinician, which usually occurs at about 20 weeks. Oscillation of fetal heart tones can be sensed using a Doppler at between 10 and 12 weeks. The reproductive system undergoes many adaptations during the pregnancy process. The uterus increases in size, weight, length, width, depth, volume, and overall capacity. The uterus shifts from its normal pear shape to an ovoid shape and begins to undergo enhanced uterine contractibility, or Braxton Hicks contractions. The uterus will ascend into the abdomen after the first 3 months of pregnancy. Fundal height by 20 weeks gestation is usually at the level of the umbilicus, or belly button, at 20 centimeters. The cervix during pregnancy will undergo softening and mucus plug formation, as well as an increase in vascularization. The vagina increases in vascularity and thickens. The length of the vaginal vault increases as secretions become more acidic, wider, and thicker than usual. The ovaries will stop ovulation and will continue to enlarge until about the 12th to 14th week of gestation. Breasts increase in size and nodularity to prepare for lactation. There is also an increase in nipple size, becoming more erect and pigmented. The production of colostrum will precede the production of mature milk after delivery. Colostrum is an antibody-rich yellow fluid that can be expressed after the 12th week of gestation. The pregnant body will also undergo many adaptations in the digestive tract. Gums become hyperemic, having excess blood, and become swollen and bleed easily. There is often an overproduction of saliva called pyelism. Gingivitis usually becomes a problem in pregnancy, even if the pregnant mother has not had a history of gingivitis or gum problems. There is also a decreased movement of food through the digestive tract, and smooth muscle relaxes. Constipation and increased venous pressure, along with pressure from the uterus, often results in hemorrhoids. As the GI tract slows during pregnancy, heartburn becomes a common problem, along with prolonged gallbladder emptying, nausea, and vomiting, commonly referred to as morning sickness. The cardiovascular system also undergoes many adaptations during pregnancy. There is an increase in the pregnant mother's blood volume of about 50% above pre-pregnancy levels. There is an increase in cardiac output, an increased venous return, and an increased heart rate. There is a slight decline in blood pressure until mid-pregnancy, where blood pressure usually returns to pre-pregnancy levels. A pregnant woman will experience an increase in the number of red blood cells. Blood plasma volume can become greater than the volume of red blood cells, leading to hemodilution, which occurs physiologically in pregnancy. This may result in lower hemoglobin concentrations, and iron supplements might be required to prevent physiologic anemia. The pregnant body undergoes respiratory system adaptations. The breathing becomes more diaphragmatic and less abdominal due to an increase in diaphragmatic excursion, along with chest circumference and tidal volume increases. There is an increase in oxygen consumption in the pregnant body. The renal and urinary systems of the pregnant body also undergo adaptations. These include a dilation of the renal pelvis, an increase in length and weight of the kidneys, an increased urine flow and urine volume, and an increase in kidney activity when lying down. The musculoskeletal system undergoes several changes while pregnant. There is a softening and stretching of ligaments that hold the sacroiliac joints and pubic symphysis around the area of the developing fetus. There are also postural changes. There is an increase in sway back and upper spine extension. You might notice that a pregnant woman will stand slightly forward, shifting the center of gravity. There is also an increased curvature of the spine, called lordosis, that occurs. These musculoskeletal changes causes walking to look more like a waddle during pregnancy, called having a waddle gait. The integumentary system, which includes skin, nail, and hair, undergo changes as well during pregnancy. One of those changes is linea nigra. Linea nigra is also called the pregnancy line. The pregnancy line is a natural part of pregnancy. The specific cause of linea nigra is unknown, but it is believed to be related to the changing hormones or imbalance of hormones as a result of the developing baby. One theory is the melanocyte-stimulating hormone created by the placenta is the main contributing factor. Another adaptation is a hyperpigmentation called the mask of pregnancy or facial melasma. When melasma occurs during pregnancy, it is also called cloasma or the mask of pregnancy. Pregnant women experience an increase in estrogen, progesterone, and melanocyte-stimulating hormone or MSH. These levels increase during the second and third trimesters of pregnancy. Melanocytes are the skin cells that cause pigmentation, making them more noticeable in the pregnant woman. Stria gravidarum, or stretch marks, occur in approximately 50 to 90% of pregnant women because of the separation of the underlying connective tissues as the uterus enlarges within the abdominal cavity. Dermal collagen is damaged and blood vessels dilate, resulting in the formation of reddish-purple early stretch marks. Varicose veins are also common in pregnant women. Veins carry blood from your organs back to your heart, which means they're basically working against gravity. This is not easy, especially when you're pregnant. That's because thanks to the expanding uterus, increasing blood volume, and changing hormones, veins are under even more pressure than usual during pregnancy. Varicose veins can develop in spots that are under the most pressure, which usually are the legs, rectum, and vulva, caused by the accumulation of blood. Another side effect of pregnancy is vascular spiders or spider veins. The pregnant woman has more blood circulating than before she was pregnant. Also, the change in hormones causes backup of blood in the veins. The good news is, though they might be painful or uncomfortable to the pregnant woman, they don't affect the baby. Palmar erythema, or reddening of the palms, is another sign many women experience. Sometimes the red areas are also itchy. It is thought to be caused by increased levels of estrogen during pregnancy. The problem is not serious and usually disappears shortly after delivery. You might notice a decline in hair growth. The normal hair loss that was delayed during pregnancy may fall out all at once. Up to 60% of your hair that is in the growth state may enter into the telogen resting state. The hair loss usually peaks about 3 to 4 months after delivery as your hair follicles rejuvenate themselves. Nails, like hair, can change during pregnancy. Extra hormones can make them grow faster, longer, and stronger. Some women, however, find that their nails split or break more easily during pregnancy. What about endocrine system adaptations? The thyroid gland becomes slightly enlarged and increases in activity, which also increases the basal metabolic rate. The pituitary gland enlarges and decreases production of vital hormones, including TSH, GH, and inhibits FSH and LH, and increases production of prolactin and MSH. There is also a gradual increase in oxytocin production with fetal maturation. The pancreas can undergo insulin resistance due to HPL and other hormones in the second half of the pregnancy, contributing to possible gestational diabetes. The adrenal glands will undergo an increase in secretion of cortisol and aldosterone. The placenta secretes HCG, HPL, relaxin, progesterone, and estrogen that all play vital roles in pregnancy. The nutritional needs of the pregnant mother definitely change over the course of the pregnancy. The direct effect of nutritional intake on fetal well-being and birth outcome has been well studied and documented. It is recommended that pregnant women take daily vitamin and mineral supplements under the direction of their doctor. Other dietary recommendations include an increase in protein, folate or folic acid, and an increase in calories over time. Also, some fish should be avoided due to mercury content. Assuming a pregnant mother begins the pregnancy with a healthy BMI, she should gain between 25 and 35 pounds throughout her pregnancy. During the first trimester, the weight gain should only be between 3.5 to 5 pounds. During the second and third trimesters, the woman should gain approximately 1 pound per week. For women who are underweight with a BMI of less than 19.8, the recommended weight gain for pregnancy increases to between 28 and 40 pounds. For women who are overweight or obese at the beginning of pregnancy with a BMI over 25, it is recommended that they gain between 15 and 25 pounds. There are many maternal emotional responses that a woman will experience during pregnancy. These may include ambivalence, introversion, acceptance, mood swings, and changes in body image. Relationships with intimate partners commonly change during pregnancy. A woman may experience stress with regarding to the changing sexual relationship. Sexual desire is likely to change with each trimester, and sexual health is linked to being happy with your partner and having a positive self-image. Thank you for watching.